White coat ceremony is a celebration where you progress from the short medical student white coat to now you're a full-fledged physician, a resident physician who has a longer white coat. So it's a ceremony to celebrate the progression across your medical training.
Residency training is when they are gaining their training for their area of specialty. And it's a very long journey up to this point. So there is a lot of excitement. It's also a little scary because you're actually starting to take care of patients officially.
But whether you like it or not, you are now today physicians. And patients, nurses, and the hospital staff will call you doctor starting now and for the rest of your life. But also, you are expected to be a leader moving forward.
Well, I always knew that I wanted to do something that would combine my love for helping people with science. As like a doctor specifically, you kind of have the last say of what is going on in a patient's care. And I think that's a really powerful and amazing privilege to have. And I wanted to be a part of that.
We went to medical school for 4 years and, we were training to become a doctor, but getting our white coats, having this ceremony kind of makes everything feel real. And it feels like, okay, wow, like I'm actually going to be treating patients starting on Monday.
We try to recruit people who are locally from the area because really we want to keep the people we train.
I went to high school at Great Oak, and then I went to UC San Diego for undergrad, and then I went to St. George's, which is actually in Grenada for medical school, and I did my rotations in Los Angeles.
I graduated from Temecula Valley High School in 2013. I went off to college in Minnesota, medical school in West Virginia, and so the fact that I'm able to be here today to kind of like represent myself and represent the specialty to a community that I really resonate with, that I come from, that I consider my hometown. Yeah, I think it's really important for me.
We've maintained over a 60% retention rate of our trainees to date, and that's exactly why we exist, is to help improve the healthcare of the region and help address the physician shortage.
We are so unique in, I think, how supportive and close our city works with graduate medical education at our hospitals.
It's just been the amazing partnership and support that we've gotten from the community. And we've really had amazing support from the leadership of Temecula Valley Hospital. I've never encountered leadership that was so supportive.
Our goal is to help you find a place here in this region when you're done. It's an amazing place to be, and hopefully you'll find that same desire to stay in this community, to serve the community of patients in this region with the expertise that each and every one of you will be able to bring. And on behalf of Southwest Healthcare, we're glad you're here. So thanks very much.